Welcome to the first video podcast for the Nurse Inquiry Mentoring Program. My name is Nicolette Hogue, and I am honored to have Dr. Tracy Gosselin, the Chief Nursing and Patient Care Services Officer at Duke University Hospital, here with me today to discuss the value of aligning a clinical inquiry project with the Duke Nursing Strategic Plan. Thank you, Dr. Gosselin, for joining us today.
Thank you for having me. I'm very excited to spend some time with you.
Thanks. As advanced practice providers, what role do we play in helping to deliver the Duke vision?
Oh, so that's a great question. So as advanced practice providers, when we think about the vision, the mission, the values of what we do every day, it's all encompassed around the patients, right? The patients are why we're here and why we do what we do. Through ongoing learning and inquiry into our practice, we set evidence-based standards of care, we help set policy and procedure, and most of all, we deliver on an experience that I think is best in class compared to others. We do this through alignment of our work, through our health system strategic plan, through our nursing strategic plan, and then at our individual entities through different work plans and balanced scorecards when we think about the targets we're looking to achieve. So the role is critically important when you think about the populations we serve that are some of the littlest patients we might care for to some of the biggest, to the youngest, to the oldest, and all the unique diseases and conditions that we treat. So the role is critically important as well as the ongoing learning to drive quality care.
Perfect. So what are some of the priorities of the nursing division, and why is it important to align evidence-based practice and quality improvement projects with the Duke Nursing Strategic Plan?
So great question. So evidence-based practice and quality improvement align really well together, right? One, we have to understand our practice, and two, we have to understand the evidence to move it forward. So when I think about the work we're doing, we are in wrapping up the third year of our Duke Nursing Strategic Plan, which is really great because then we get to celebrate what we've done. And then what are the opportunities we want to look for improvement going forward in our next plan? So we are in the midst of working through that. Why is that so important? Well, it helps support our fundamentals of practice across our care continuum, which is critically important when you think about the different places and locations that we serve patients. So when I think about quality, I think quality is why people come here. Quality is the experience you'd want your loved one, your family member to have. And we know that the best evidence drives quality care. We also know, though, that nursing is a very young profession. And as a profession, we don't have some of the literature and research always behind our practice, right? We're one of the younger sciences per se. But what that allows us to do is have that investigative spirit to say, who should we partner with to help us do that research and then drive the change in practice through policy, through procedure, and in collaboration with colleagues. So when people think about the magnet journey and what magnet means, well, magnet at the end of the day is about quality. It's about high quality care, right? Care that's safe, care that's effectively delivered to the person that we're delivering it to. And the other piece, when I think about the alignment of evidence-based practice and QI, they really dovetail nicely together because it's a way to monitor, whether it's through a PDCA cycle or other type of quality improvement tool you'd want to use to understand how are we gaining traction and making it better. Sometimes I think we get disappointed when we're like, those results aren't great. It's not an A. And if you've ever read the book, Good to Great, sometimes good is a good place to start, right? We got to kick the tires a little bit, see what could be better. Maybe there were opportunities that we didn't address that we should have. So evidence-based practice and quality improvement really go hand in hand when we think about the practice of nursing and the art and science of care that we deliver.
What suggestions do you have for advanced practice providers to get started in participating in EBP and QI projects here at Duke?
Yes, so we are very fortunate at Duke. We have a colleague by the name of Deborah Allen. She goes by Hutch. She is a PhD prepared nursing scientist for us that we work with. And Hutch does a boot camp on evidence-based practice. That's one opportunity if you really haven't had the opportunity to be exposed to the concepts of evidence-based practice, from what is the population I'm thinking of? What is the question I'm trying to solve? Because it's always interesting when we think about, oh, I really want to fix this. Well, sometimes fixing this maybe should be about fixing this, right? And so how much of that question, or ocean, as some people say to me, how much of the ocean are you trying to boil? So there's Hutch is a phenomenal resource. The other resources we have that we're very fortunate to have is we have a librarian on staff who helps support with literature searches. Now, that can be a little daunting some days, right? What are the right words, the right keywords? And Beverly is fantastic at helping our staff, our leaders, all do that, because it's not something we do every day. But you really want to use her to help, because she's the one who knows all the key search terms and words and how to best structure that search approach. The other people who are extremely helpful are our magnet leaders in each of our institutions, who keep an eye on the work we need to improve, right? There's always opportunities for improvement. So is that something specifically around falls? Is it something specifically around patient experience in an area? Because those quality outcomes are what supports our magnet document. So getting involved with magnet, getting involved with Hutch, other opportunities within the multidisciplinary teams you work with about questions regarding care, right? Diabetes adherence to certain measures and things that are being looked at, or behavioral modification, sometimes when we talk about smoking cessation, right? Also looking for experts, because I think sometimes when we think about the work we do in quality improvement, we're fortunate to have many experts in a variety of disciplines that work here. So reaching out to them to see if they're willing to help. And sometimes, again, it doesn't even have to be in your own discipline. Sometimes a pain management expert might be a psychologist that runs an ambulatory clinic and sees patients. So when you think about that, there's a variety of opportunities and resources to help. We also have, many of you have probably heard of IHI, the Institute for Healthcare Improvement. The university side has its own chapter of that as well. So another opportunity to look at evidence-based practice.
It is inevitable to encounter barriers on these types of projects. Can you tell us about some of the barriers that you have seen most frequently and how we should address them?
Yeah, great question. So barriers, right? We often think of them as hurdles, the things you might need to jump over as you think about being in school and getting from point A to point B. But when you think about it with your project, right, there's this fundamental piece about change. So you are asking someone to change, right? Maybe change their practice, change how they document. Maybe their sterile technique isn't what you thought it should be. Maybe their documentation, right? Or their way they educate patients, or the way they run their clinic, right? So when you start evaluating practice, sometimes to people, it feels like, I'm getting evaluated, right? So understand the setting you're going in, the people you're collaborating with, and the impact you're going to have on people. So if you went to someone and said, you know, I noticed the documentation fields didn't have all the detail, and we're going to give you 25 more fields in Epic to document on, they may, why are you asking me to add more, right? And I think that is sometimes the place people come from with resistance. They don't understand the why. And there's a really great book by Simon Sinek that says, starting with why, start with the why, right? And so what is the problem? And this goes back to understanding your PICO question. What is that very specific question in the evidence? Because what you will learn is that once people understand the why, they're less resistant to want to maybe not change, right? So that resistance piece helps. And we know with any type of change, there's sort of a bell curve. There's the accelerators who are like your 2.5% who are out of the gate, who love change and are ready to go. Then you have your big bell curve. And then you have the other 2 to 5% at the end who are your laggards, who are like, oh, we've been here for this change. Now you're asking us to change again. So understand the environment and the team you're coming to. Also, what's the opportunity for them to give input, right? Are you just looking at the evidence? How do you best share that evidence with them? Are you also talking to patients and families about what that care looks like? And maybe how could other members of the team that might be having this change be a part of that in those listening sessions? Because we're so focused sometimes on providing the care to patients and families that sometimes when we step back and say, tell us about the care, how would you like to receive the care? It sounds very different than what we might have always thought. And I think that's really an important piece. One of the great tools we're very fortunate to have is we do have a health system patient and family advisory council, which is made up of exactly that, patient and family member advisors, where we're able to take projects to that help sensitize them to that. And the nice thing is they have a lot of awareness about our balanced scorecard and how it's structured. So they're usually not surprised when we bring in projects that are tied to quality and safety and our harms reduction efforts or patient experience. So those are really important things. The other piece is as you're going through your project and once you've implemented and you got your stakeholders engaged, right? Because you're going to want some key stakeholders, is find time for feedback loops. What do you need to iterate on to make it work better, right? So it's moving from good to great and thinking about those listening stations and those posts and then coming back around when you're done and sharing the data, right? What is the improvement you saw? What is the year over year or month over month? Did patient experience scores improve? Did you see a decrease in falls? And sharing that with the team and celebrating that with them, because your project work is really focused on them being able to carry out the plan that you want, right? And so that relationship is really important, and thanking them for that. So variety of barriers, sometimes there was a project a few years ago where it was related to a clinic design and how some things were set up in the environment. So it could be environmental, it could be time, it could be space, it could be resources related to people or computers. And so just having a really good understanding going into it about the environmental context that could potentially be barriers, but also might be great supports depending on your project.
Thank you, Dr. Gosselin, for your time. We really appreciate you joining us today.
You're welcome. Good luck with your projects.
Thank you.